Green tea contains nutrients and antioxidants that provide many health benefits, from reducing the risk of heart disease, cancer, and diabetes to increasing longevity or improving brain function. Green tea is a type of tea made from the same plant as black and oolong tea. However, the leaves and the buds used to make green tea don't undergo the same withering and oxidation process. Green tea contains polyphenols and catechins, which are antioxidants, micronutrients naturally found in plants. By reducing free radical production, they may help prevent several diseases. Epigallocatechin gallate, or EGCG, is the main polyphenol that's found in green tea, and it has many potential benefits for human health. L-theanine is an amino acid, and it's similar to glutamate and glutamine. It's another component abundantly found in green tea. It's been specially investigated for its potential at improving cognitive function and curbing anxiety. Green tea is also a rich source of many minerals. Some of the benefits of green tea are its high content of antioxidant compounds. It's approved for genital and anal warts. It may help to prevent heart disease, prevent some cancer types, prevent diabetes, improve cognitive function, improve oral health, and may help with weight loss. A topical ointment with green tea extract was approved by the FDA in 2006 for the treatment of genital and anal warts. In 4 clinical trials on over 2,200 people, it was effective and well tolerated. A meta-analysis of 9 studies on almost 260,000 people associated green tea consumption with a reduced incidence of heart disease. It was dose-dependently associated with fewer heart attacks. Drinking over 10 cups per day was associated with lower LDL levels. Its flavonols were identified as the protective compound in another meta-analysis. The protective effect seems largely due to its ability to lower blood pressure and to improve blood fat profile. Multiple meta-analyses of clinical trials found that drinking green tea also reduced blood pressure, total cholesterol, and LDL cholesterol. The evidence suggests that green tea may help to prevent heart disease by lowering blood pressure and cholesterol, both total and bound LDL. In 2 studies of over 350,000 Japanese elderly people, drinking more than 3 cups of green tea per day was associated with lower rates of death from all causes, heart disease, stroke, and respiratory disease in both gender, and from cancer in women. In another study on over 14,000 Japanese elderly people, drinking green tea was associated with a 76% lower mortality during the 6-year follow-up period of the study. Green tea was associated with reduced death from all-cause and heart disease, as well as with lower incidence of colorectal cancer. Polyphenols in green tea protected telomeres from shortening in cell-based studies, suggesting their potential to increase longevity. All in all, the evidence suggests that green tea may help to increase longevity. Oxidative damage may trigger several cancer types. As a rich source of antioxidants, green tea may help to prevent them. In an observational study on almost 70,000 Chinese women, the regular consumption of green tea was associated with a reduced incidence of colorectal cancer. 4 meta-analyses associated drinking green tea with a lower incidence of colorectal cancer. In 2 clinical trials on 276 people, supplementation with green tea extract reduced the incidence of colorectal cancer type, metachronous colorectal adenoma. In a study on over 4,000 French women who were consuming green tea and other antioxidant beverages, there was an associated lower incidence of breast cancer. However, a study on over 1,500 women failed to associate the regular green tea intake with breast cancer. In a small clinical trial on 12 women with breast cancer, a formulation with epigallocatechin gallate, or EGCG, efficiently delivered the polyphenol into the blood and the tumours, and it reduced a biomarker of breast cancer. Meta-analyses found a slight trend towards reducing breast cancer incidence in women drinking high amounts of green tea, although they generally considered the evidence insufficient due to the high heterogeneity of the studies. The most recent meta-analysis did find that green tea was effective at protecting from breast cancer, especially from its reoccurrence. In an observational study on almost 50,000 Japanese men, green tea consumption was associated with a reduced frequency of advanced prostate cancer. Two meta-analyses concluded that green tea, but not black tea, may help to prevent prostate cancer, especially in Asians and in people taking over 7 cups a day. However, another meta-analysis of 21 studies found no association. In a clinical trial on 60 men with a condition that often develops into prostate cancer, a high-grade prostate intraepithelial neoplasia, the daily treatment with green tea catechins helped to prevent this type of cancer. However, a similar trial on almost 100 men at risk of prostate cancer found that green tea was ineffective as a preventative measure. Nevertheless, a meta-analysis of 13 studies found that green tea was slightly effective. Although they reduced the levels of prostate cancer markers, or PSA, in some studies, green tea polyphenols had little or no effectiveness in preventing prostate cancer in most trials on people without high-grade prostate intraepithelial neoplasia. One of them even associated green tea supplement with an increased incidence. Green tea polyphenols reduced liver cancer biomarkers in 2 clinical trials on over 200 people at high risk of developing this condition. 3 meta-analyses found an association between green tea intake and a reduced incidence of primary liver causes. In 2 clinical trials on over 200 heavy smokers, drinking green tea reduced oxidative damage to the DNA, possibly reducing the risk of lung cancer. 3 meta-analyses concluded that green tea may protect against lung cancer. However, a small trial on 17 people with advanced lung cancer found that green tea was ineffective as a chemotherapeutic agent. 3 meta-analyses associated green tea consumption with a lower incidence of ovarian cancer. In a clinical trial on 59 people with mouth lesions that may develop into mouth cancer, oral leukoplakia, drinking green tea and applying it topically reduced the size of these lesions and some of the markers of oral cancer progression. A meta-analysis of 14 articles on over 4,600 people associated green tea but not black tea consumption with a reduced incidence of mouth cancer. In 3 pilot trials on 87 people with leukemia, green tea extract reduced lymphocyte counts. Studies investigating the potential preventative role of green tea on the following cancer types produced mixed results that don't allow us to draw conclusions. This was bladder cancer, endometrial cancer, stomach cancer, esophageal cancer, and pancreatic cancer. Mouth rinses with green tea extract reduce plaque buildup, gum inflammation, and the salivary counts of microbes that may cause cavities and gum disease, in a clinical trial on 225 people. Green tea extract also inhibited cavity-causing bacteria in test tubes. Similarly, the EGCG reduced the growth of S mutans when incorporated into a dental glue. Mouth rinses with green tea reduced dentin wear in 2 small trials on 22 volunteers. Chewing gum with green tea remineralized enamel lesions in another trial on 45 people. A green tea gel applied after a non-surgical treatment reduced gum bleeding and inflammation in a clinical trial on 48 people. Similarly, a mouthwash with green tea reduced pain after tooth removal in another trial on 48 people. Oral green tea tablets reduced the compounds that cause bad breath in a clinical trial on 54 people. The existing evidence suggests that green tea may improve oral health by preventing infections, protecting the enamel, and reducing inflammation and bad breath. Epigallocatechin gallate, or the EGCG catechin, caffeine, and L-theanine all may work to improve brain function and health. The amount of caffeine found in green tea is enough to help to improve memory and reaction time, as well as to boost dopamine and norepinephrine in the brain. In a clinical trial on 12 healthy volunteers, green tea extract improved brain activity in a key region of the working memory processing area, the dorsolateral prefrontal cortex. Green tea increased brain activity, especially theta waves, in another study on 8 healthy volunteers. This suggests it has potential to improve alertness and attention. The L-theanine especially increased alpha waves, which are associated with mental alertness and arousal, in another trial on 35 healthy people. A combination of green tea extract and L-theanine improved memory and attention in a clinical trial on 92 people with mild brain damage. In another trial on 27 elderly people with cognitive dysfunction, drinking green tea didn't improve their symptoms, but it reduced oxidative damage, possibly helping to reduce the progression. The epigallocatechin gallate, or the EGCG, improved visual recognition memory, working memory, inhibitory control, and adaptive behavior in 2 clinical trials on over 100 people with Down syndrome. It also improved cognitive function in mice who had this condition. In a meta-analysis of 7 studies and over 286,000 people, drinking green tea was associated with an 18% lower incidence of type 2 diabetes. Its potential to improve blood sugar control in people with type 2 diabetes or at risk of developing the condition is less clear. While it was effective at reducing fasting blood sugar in 2 meta-analyses and fasting insulin at high doses in one of them, a third one found that green tea was ineffective at lowering type 2 diabetes markers in people who were at risk. The differences observed may be due to the heterogeneity of the populations. A meta-analysis found the green tea was especially effective at lowering fasting blood sugar in people below 55 years of age or people of Asian origin. The effects of green tea on weight loss have been tested in multiple clinical trials. Although several studies have found that it helped, the results were modest and mixed. 3 meta-analyses of 44 studies found that green tea and its catechins promoted a slight weight loss. A meta-analysis of 8 studies found that they may do so by promoting fat burning and energy expenditure. However, 2 other meta-analyses of 21 studies concluded that green tea catechins only promote fat burning in combination with caffeine. Green tea had no effect on appetite hormones leptin and ghrelin in a meta-analysis of 11 trials. A topical application of creams with green tea extract improved skin elasticity, reduced wrinkles, and it protected from the harmful effects of UV radiation, such as aging, burns, and immunosuppression, in 5 clinical trials on 87 people. However, another trial on 40 women found it to be ineffective. The result of trials using oral green tea polyphenols are mixed. These compounds had similar effects to a topical preparation in 4 clinical trials on over 150 people, but they were ineffective in 3 trials on over 150 people. In 2 clinical trials on 99 people with acne, drinking decaffeinated green tea daily for 4 weeks reduced inflammatory lesions on the nose, the chin, and around the mouth. Cell-based studies found that the epigallocatechin gallate can block fat secretion in the skin and can inhibit a microbe that causes acne. In a clinical trial on almost 400 people, topical green tea resolved skin Mrsa infection in all cases. In a clinical trial on 200 healthcare workers for the elderly, taking green tea catechins at 378 milligrams per day, and L-theanine at 210 milligrams per day, it reduced the incidence of the common flu. However, gargling with green tea was ineffective for flu prevention in another trial on over 750 children. Green tea was also of little effect against upper respiratory infections in a clinical trial on almost 300 people. In test tubes, green tea and its components did inhibit several infectious bacteria. In a clinical trial on 171 postmenopausal women with low bone density, an intervention with green tea polyphenols and Tai Chi improved bone formation, biomarkers, and muscle strength, while reducing oxidative damage that may worsen bone loss. The intervention was safe and well tolerated. However, another study on almost 1,000 postmenopausal women who were given green tea extract for 12 months found it to be ineffective at improving bone mineral density. The epigallocatechin gallate promoted bone development in cell-based studies. In a clinical trial on 17 people with non-alcoholic fatty liver disease, a high catechin green tea reduced fat content, inflammation, and oxidative damage in the liver. Similarly, it reversed mild fatty liver in another trial on 60 people with high blood cholesterol. However, high doses of 1,315 milligrams of catechins per day for 12 months were toxic to the liver in a study on over 1,000 women. The polyphenols in green tea stimulated human hair growth in test tubes and on the scalps of 2 volunteers. Drinking too much green tea can cause adverse effects associated with caffeine intake. These include anxiety, accelerated heart rate, and sleep disturbances. L-theanine found in green tea can also cause dizziness, headaches, and digestive problems. Due to the effects of caffeine on heart rate, people who are suffering from heart conditions, as well as pregnant and breastfeeding women, should drink green tea in moderation. Because caffeine has diuretic effects, people on diuretics should drink green tea in moderation also. Some studies have revealed the capacity of tea plants to accumulate high levels of aluminium. This heavy metal may build up in your body and cause brain and kidney damage. To reduce your potential exposure to aluminium, make sure to obtain green tea from reputable sources. Although rare, excessive EGCG of over 400 milligrams per day can cause liver toxicity and even liver failure. Tea polyphenols reduce iron absorption in rats, so people with anemia may want to cut down on green tea intake. Epigallocatechin gallate acted as a pro-oxidant rather than an antioxidant in the pancreatic insulin-secreting cells of diabetic mice. Further clinical studies should determine its safety in people with type 2 diabetes. In rats, green tea consumption lowered testosterone levels by 20% and sperm count by 2%, suggesting its potential to reduce male fertility. At high doses, green tea extract induced thyroid enlargement, or goiter, and it altered thyroid function in rats. However, people drinking green tea are unlikely to reach such high doses. Fish oil in combination with green tea catechins may increase fat and glucose metabolism. Ubiquinone, a form of coenzyme Q10, increased the antioxidant effects of the EGCG catechin in rats. Curcumin combined with the EGCG catechin reduced cancer cell growth. Capsicum vanilloids found in hot peppers help to kill cancer, and them being combined with green tea had a synergistic effect. And vitamin E in combination with green tea polyphenols improved exercise capacity, lowered glucose levels, and reduced body weights in humans. An ointment with 15% green tea extract is approved for genital and anal warts. Studies saw benefits from drinking 1 to 10 cups per day. You shouldn't exceed 400 milligrams of the epigallocatechin gallate per day, as more consumption of this has been associated with liver issues. Epigallocatechin gallate generally has poor bioavailability. You can increase the uptake of this polyphenol by taking it in combination with piperine or black pepper extract, vitamin C, fish oil, or fasting. Because calcium and magnesium reduce its absorption, you might want to avoid combining it with supplements or food high in these nutrients.